better sleep, sharper focus, a healthier life. It all starts with how you breathe.
Welcome to the No One Told Me, the Airway Health Connection, the Untethered Way, where better breathing meets better living. I'm Dr. Meggie Graham.
I'm Dr. Liz Turner.
We're the co-founders of Untethered Airway Health Center,
on a mission to help you breathe freely and live fully through proactive airway health.
Whether you're a dentist expanding your airway expertise
or a family looking to sleep and breathe easier,
you're in the right place.
Each week, we'll bring you bold insights, real-world stories, and expert tips.
All to help you take control of your airway health. Because when you breathe better, you live better. Let's get started. I'm so excited to have Beth Morel here today. She is one of my favorite Instagram follows, and that's actually how I think we became friends, was me stalking you on Instagram and reaching out about different cases, probably before the pandemic, because it was at the same time you were launching Bubbles and Babies, or I don't remember the alliteration, but it was such a cool program. And ever since then, we've kind of tossed cases between each other a little bit, but I still just follow you and I'm in awe of what you do. So your background is a pediatric physical therapist,
right?
With now a niche understanding and focus on airway and how that affects the entire chain, correct? Am I describing that background okay?
Yeah, that's pretty much it, with a craniosacral focus to it.
I mean, you're combining so many things that are so important. And I think that, especially being on the online world, we get questions all the time, like, how do I find somebody like that? And I have, to be perfectly frank and honest, like, haven't found somebody like you anywhere else. Your expertise is so nuanced and so specific, and it's so important that I want it to be one of the biggest reasons I wanted to have you on today was not only just to hang out with you and chat with you, but like to spread awareness, because I think that your nuance and your approach to early body work, early function is so impactful. And I don't think enough people know about that from the patient perspective, but also the provider side of things.
Yeah, I mean, I feel like it's a little bit lucky, I have to be honest with you, just because my kids drive and have driven my entire career path. I shouldn't say my entire, I was always a pediatric PT, right? I actually went to PT school thinking that I was going to be an orthopedic sports physical therapist because I played sports my whole life. I was super into it. I was into just like the anatomy and physiology. My sister had ACL repair. Like we had all these things going on. And I also really liked kids. But after I applied and I got in, my mom's secretary's husband was a NICU physical therapist. And I was like,
wait,
this is a thing? Like this is a thing? I can see little babies and be a physical therapist at the same time. And so I knew that like that niche existed, which again, I feel like it's all luck because even if you didn't even know that niche existed, you wouldn't have your mind processing in that direction. So when I did my clinicals, right, you have to do it in all different settings, and I did outpatient orthopedics, and I hated it. I I couldn't stand the weekend warrior dad who tore his rotator cuff playing softball at 45, thinking he was 20. And, we would go and stretch them and they'd be like, no, don't do this. And I was like, okay, I'm 20 and you're 45 and you're complaining.
And he's probably looking for a quick fix. He wants to get back out there and tear the other one.
Yeah. And that's right. I was like, I'm all done with this. I don't think this is the right path for me. However, I still really like physical therapy. I really like kids. And then as I got into my other clinicals, like I did the school-based clinical and I really had liked it. And so I knew, okay, kids was probably the way I was
grade school?
Preschool. It was especially at preschool.
Okay.
So 3 to 5, and that is actually where I started my career. But I then, because of that person that we knew, was like, okay, I know NICU physical therapy is a thing. I want to go, I want to observe it. I want to do it. And I created my own internship in California because I live in New York at the time, Long Island, and in California. And I lived in West LA and I was in Burbank. I was literally next door to Ellen's studio and they let me in because in California, OT, PT, speech all did the same job in the NICU. It wasn't like you have this scope and you have to do this.
You all have the
There,
same role.
yeah, it was like the rotating person. And I had, made this clinical in advance that like I was going to go here. And they said, yes, as long as you do inpatient care, you can also go to the NICU. So that's what I did. I did 1 week in the NICU, 1 day in the NICU. And then the other days, the long days were in inpatient. And I was like, yes, I love this. So this is where I knew that that was a thing. And I knew that that's where my brain was going to go. So my goal coming out of PT school was always I want to treat the baby. I want to treat the baby. And you on the East Coast, moving back and living in New York,
How long were
you
you there? How long were you in California?
you only an internship, so just a
Okay.
summer,
Okay.
right? Um, and coming back, you like here, only the senior physical therapists who were on the job for, 15 years would be offered some sort of baby position in a NICU. And I knew that was going to take time and effort if I was going to stay on the East Coast. So I didn't go that route. I started in preschool and then went down to early intervention. And then I went to outpatient kids and I treated all the babies. So I started treating babies, a couple years, 3 years into my, PT career, and really got that good handle on infants. And then when I had Melania, who's just turned 11, that's when this whole thing started steamrolling, where you kind of feel like you think you know what's happening until you're presented with these issues, right?
Different when you're the mom. Like I can look at, dozens of cases and like be very objective with diagnosis and treatment plans and thought process. And I look at my own child and I'm like, what? I have no idea what to do. It's really hard.
It's really hard. And I'm also stubborn. So there was a problem with that too, right? Where she was born, I mean, she lacerated my nipple on the first latch. Like I was literally bleeding in
Mm.
the labor and delivery room, not even in recovery, like in labor and delivery. And I was like, hey, I need lactation. And they were like, okay, crazy lady, just wait. And long story short, I was like, I heard about this thing called the tongue tie. Is this really a thing? And everyone just kept knowing me. And that's how it evolved, right? By the time we got the diagnosis and got the treatment, by our wonderful Dr. Siegel, who again, I also feel like this was luck too. The lactation consultant that finally listened to me gave me a few options. And I said, well, who's the best? And she's like, well, this guy is doing research, so go to this guy. Which he's wonderful. He's like a great human. And I said, okay, so where's the rehabilitation? And he was like, yeah, so it's you could go to Cairo. And I was like, great, nervous system alignment. Where's the rehabilitation? And he's like, you could go to craniosacral therapy. I was like, yeah, these appointments are already booked. Where's the rehabilitation? And that's when he was like, we don't really have that yet, like specific toward
How old was she at this point? How long did you have to wait?
a month, which I guess now people would say like, oh, that's not a long time. I mean,
But a
we have
month of
no
lacerated
refusal,
nipples is hard.
it's the same thing that everybody feels, right? I was cut open, so I would pump, and then she had breast refusal, then she had bottle refusal, and then I would get clogged ducts, and I would pull them out with tweezers, and obviously you're not supposed to do that, don't do that, but that's what I would do, and then I would pump again to try to get it all out, and it was just like rinse and repeat for a solid month, and I had 4 lactation consultants before anyone even listened to me about what could be some sort of tongue tie, and we didn't have Facebook groups then. We didn't have, I mean, the internet was like not unhelpful at that point. So it was just me being stubborn, and that's how that kind of path went on, and that's why I made this, promise to myself that I won't let other families go through the same thing that I went through.
I
But
just,
then,
I just said this the other day that like once it becomes personal, like it's like a fire. You can't not double negative, can't not be passionate about it, right? Like you're like on fire now.
well, and then the other problems ensue. I say like they're my like leaders in all of this, but even the unhealthy guts, right? So then I start connecting the dots of the unhealthy gut, and she was the puker, he was the non-gainer, right? And those are both inflammatory issues.
Mhm.
So that you go down the rabbit hole of, okay, well, what's the actual issue behind this? And then I went down the whole Ben Lynch dirty genes situation, right? Of what are the genes that may have caused all of these issues to begin with? And then you're inheriting 6 generations of gut health from your family, and you're inheriting 6 generations of mental health from your family. And all of these things play a role in this baby that you have just given birth to, right? That they have no part of, right? They have inherited your gut health, your grandma's gut health, your great grandma's gut health. They have inherited any sort of trauma that may have happened down the line. They have inherited this quote unquote, those oral ties, and this tension, and, living outside of New York City with the stressful job and this and that, they have no part of this. They're just
And the
that.
way that they're carried in utero and the way that they came out of your body, like all of these things are impacting this little person's very first moments.
Literally. And then first
Mhm.
years and first whatever. So I think that though all of those things combine is how I really became me in particular, and every provider's his story is unique to them,
Correct.
right? Especially as a woman in medicine. I would say especially that, because I do work with a lot of men who come in here and like, especially frenectomy providers, and this is their job, right?
Correct.
Not this is their story that
Mhm.
is bleeding out.
That's such a great way of describing it because you're absolutely right. And I've noticed that time and time again with, it doesn't make them bad practitioners. It doesn't make them bad at what they do, but there is an element that comes in with the female providers. And that is exactly that, the story, the personal side of it.
Yeah, and I mean, I've had providers in our area, I've said, hey, you just had a baby. Bring me your baby because I want you to physically see what I see in your child, whether or not they have these issues or not. I'm just going to tell you what I see and what I would be doing with this child, and how this is how I treat your patients when you do it. And I do feel like, they didn't give birth to that baby. So there's just a little bit of a split, right? Where they're learning it, right? They're understanding this knowledge, and they can repeat this knowledge, and obviously practice good
They're
medicine,
not
but
living it.
they're not living it. Yeah. Like, oh, do you see this when I roll your kid over? Do you see this? The way that they're, utilizing their function. Do you see this? Your child is bottle fed. So therefore, these are the muscles they're using. And they're like, oh, yeah, right. I mean, because they didn't give birth, and they didn't have the nervous system that the mom did, and they didn't have the stress level that the mom did. So all of these things play a part. And I think it's just good for everyone, including our providers, to see it from somebody else's perspective.
Totally. I 100% agree with that. For anyone that's listening right now, if you're on Instagram, go follow Beth at Little Movers PT. I mean, your social media presence is amazing. It's so educational, it's so honest, it's so impactful because you just break it down so granularly and make it accessible to all levels. Because even though I'm in, the medical field, so much of this is foreign to us. This is not something that was taught at, grad school or different programs. So to watch you break it down was like it was one of the biggest dot connectors for me. So I thank you for doing what you do there. Um, so then you had Melania. How much longer until you had your son?
Marcelo is 2 years younger.
Okay.
And a different story. I'm have stage 4 endometriosis, which is a whole different story, but she's
Mm.
IUI. He is a surprise. So again, two different methods in terms of conception, which in my opinion also has led to two different nervous systems as well, right? The stress of going through fertility treatment, even though I definitely played it cool as much as I could, I really tried to be like, I'm young, we have time, this and that. Um, they have two completely different nervous systems, and I can't say that that's definitely not the situation, that there was some part of that to be said, right? Like
There's
stressful
so many
conceiving.
components.
Yeah. And him being a surprise was a different story, right? Because
A
my
different
doctor
stress.
said, yeah, like I would never, she was like, you'll never get pregnant on your own. Don't even think about it. Don't even worry about it. Like in the future, when you want to have another child, you come back and we work for it. And I was like, great. And then I had little movers. I was completely independent. I before that had been a contractor, so I had my own caseload, but within like basically an umbrella.
Okay.
Uh, and then once she was born, I went completely independent. It's just me, myself, and I all the time. And I had a grown practice, a thriving practice, and along comes this pregnancy. And I was like, oh goodness, this is something. And I asked for a beta, and they were like, ma'am, why do you need a blood test? Didn't you pee on a stick? And I was like, totally, but I thought I'm not
But this
supposed to
is
be pregnant.
impossible. I'm not supposed to be pregnant.
Yeah, yep, right. And they were like, it's a miracle. And I was like, great, it's a miracle.
What do I do with my
Just
business?
that. Yeah, like I'll do it just that. And so much so that the OB called me and was like, my nurses are worried about you. Are you okay? Of course I'm okay. I'm just surprised. And I have a business and I have a
A
toddler
baby.
now
Yeah.
who has a heightened nervous system, is still puking at 1 year old, like all the things, you know? So sure, I'm excited. I'm happy. It's a blessing. Of course, we wanted another child.
All. It's and.
It's all. But thankfully, he came out super sweet and easy and cool, calm, and collected. He gave us the other side of that, and he gave us the completely low tone child. So
Super
Mariah
chill.
also has low tone, right? She has lax ligaments, but I watched her develop those much quicker, right? She came into stability a lot quicker, and he was a floppy noodle for forever, right? I mean, it didn't matter what body work we were doing, what treatments we were doing. A head turning preference one way would then turn to a head turning preference the other way, which is more a cry of stability than anything else, right? A cry for stability, a cry of instability. And I knew this was coming. And again, you fast forward 2 years later when he still had pain, and I was like, this kid has Ehlers-Danlos. There's no way that this kid does not have Ehlers-Danlos because he
The
meets every
first thing
criteria.
I thought about is there a connective tissue issue?
Yep. And if when you go to genetics, they just say, like basically, who cares? Why are you here? Well, my 2 year old is in pain. Like 2 year olds are not supposed to be in
What kind of
pain.
pain were you noticing, or how did you know that?
Knee pain, knee pain and back pain, from walking.
Mm.
We live in
What
a
do you?
cul-de-sac. We live in a cul-de-sac. Like you couldn't even get, so we were the one house away from the dead end. You couldn't even get from our house to like the cul-de-sac without him being like, I'm all done. And he, like a 2 year old boy, they're supposed to be nonstop, Energizer bunny. And he would just be like, well, my body hurts. Like, hello, red flag. Here you
Right.
are. We did genetics and everything else came back negative. And I was like, so does that mean he has Ehlers-Danlos? And they're like, well, it's kind of like a rule out everything else. So sure, it's Ehlers-Danlos, but we're not giving you that diagnosis because he's two. So I said, okay, thank you for the diagnosis. Right. Now I understand what's happening in my family. And you like rewind the situation. My mother, had been going to physical therapy and they sort of told her the same thing. And I was like, it's you. You are the person who gave it to us. And it's me, I'm sure for sure lax, but because I played sports my whole life, I created that stability. And that's what that is. Like connective tissue disorders are all of that. But when we look at again, how does that help me in my practice? This is the kid who could not, no matter what we did, like, his wound, his frenectomy diamond would close within 5 hours. I was ripping open a diamond every 5 hours, which is the super healer kid, right? Like that has everything to do with connective tissue disorders. And how you treat those as the therapist on the forefront and back end is going to be completely different of how you would treat a child with,
Normal.
normal
Yeah.
tone, right?
Mhm.
They need a heck of a lot more therapy beforehand, before even thinking about a frenectomy than another child, right? They need more support on the back end. You need other, things in your pocket, like, hey, have serapeptase on hand because these are kids who do really well if they're trying to super heal, having that enzyme to kind of break that down
Break down
for
the
them.
fibrin. Yeah. And I think that
Mhm.
that's the thing that I think is so nuanced and what so many providers don't understand. Let's say we get past the confusion of what is restriction, what isn't restriction, right? Like that's one big hurdle that you experienced with your first. Now let's say we're past that. Now we have a provider that's willing to treat the restrictions, like the complexity of
Right.
that individual and how they present and how their tone is and how their function is and how their reflexes are and how they might heal absolutely plays a part in not only the timing of intervening or not, but also what modalities are necessary pre and post, right? Like there's a lot of providers that we're hoping to connect with and teach along the way that, okay, we can get past the diagnosis and the treatment planning, but that's only step one. Now you start now you just need exposure to start to understand that not every person's going to get the same recipe. Not every person's going to get the same checklist. It has to be very individualized.
Yeah, and I think the provider, the frenectomy provider themselves also has to have a lot of guts, like a lot of self-confidence in turning around and saying to a family that, hey, you know what? I don't think that this kid is ready for, and they have to understand what that would look like on their end too. But like, I don't think this kid is ready for a frenectomy. Do I see, oral ties here? Is that inhibiting function? Yes. Maybe you got referred from the lactation consultant. And again, like this is not neither here nor there. I'm not coming at lactation because
No.
of course they are integral providers. However, this is very nuanced. So like as an IBCLC might see a or oral tethers and say like, oh, they look like they'd be good to go get a frenectomy. Well, the frenectomy provider then has to say, this kid seems pretty floppy. You probably need more therapy than what you have already got.
Additional to your IBCLC, now you also need this help. And that's really challenging. And I think that's where we're getting stuck, because then babies are being treated prematurely or with good intention, but then the outcomes are subpar. Now the pediatricians are seeing subpar outcomes.
They told you so.
Families aren't getting relief. Or things are going south when they were, fine. And now it's very easy to make a black and white statement that frenectomies are bad. And it's nothing is black and white. We know that, but that's I think the nuance that I'm trying so hard to spread awareness to, and why what you do is so important.
I mean, even in our very skilled providers, because living in this New York City area, we have a lot of skilled providers. There's still conversations that are always have to be had in terms of like, hey, I was referred this baby and uh, they they're really struggling and they probably should not have been released. And I just want to tell you this on the back end so that
You can
we
learn.
are very careful, yes, about who is being referred and who's not. And there is a little divide here in terms of also lactation care versus therapeutic care. And not every therapist is made the same either. Everyone has their own unique training experiences. Every day on Instagram, I get new therapists, which I'm so grateful for, saying like, oh, what classes should I take to then go become, whatever, a therapist, which is great, right? And those are constantly changing too, of what was recommended. The classes that I took 11 years ago don't even exist right now. They were there as the first, like we were the first group of therapists who were really trying to do the pre-work and the post-work, and now those same exact courses don't exist. So I have to stay up to date myself on also what
When are you
exists.
launching yours?
I like to stick to the parent education. I actually have a guide that I have made, and I have a lot of things that are made, Maggie. I've wrote an entire book
Yeah.
that
Oh my gosh.
years ago that where is that? I don't know. Um,
It's on some hard drive on a floppy disk.
it's here. Yeah. Um, I have a book. I have an entire frenectomy provider, what to look at. Like, what am I looking at? Basically, I wrote a little coursework of I'm a therapist. From my eyes, what am I looking at so that you understand when you go and evaluate this, what do I see?
Have
Right? I
you
wrote
have you
that.
made that accessible? Launch that shit. The world
Because
needs it.
I think that's the thing is that all of these things, yeah, I just get sidetracked with what's good.
Totally.
But
I think people like you,
imposter syndrome too,
yeah, and we live in the land of ideas, right? Like we can keep producing, but then like the follow through is hard, and then the imposter syndrome is real. And there's a lot of, whatever reason, well, I know the reasons, but there's a lot of negativity around what we do, even when we know that what we're doing is correct or right. It does take a really thick skin to put yourself out there and be that vulnerable.
Yeah. I mean, even past this baby land, right? There's so much more that you have to think about, even when you're talking to the parents on the first visit. When I see this baby, let's just take that floppy baby, right? Because I actually see that a little more than I would
The
care.
tight baby. Do you see the floppy baby more than the tight baby?
So the tight, let's just talk about that really quick. The tight baby, often becomes the floppy baby.
Okay.
So the tight baby is holding on for dear life. That, people see this as high tone, and whatever they want to call it. It is not often, most of the time, unless there was an upper motor neuron lesion or anoxia at birth. So they had difficulty breathing, they got stuck in the birth canal. There was some sort of birthing issue. Most of the time, this is not that. High tone comes from some sort of anoxia or incidents, right? It's more that these babies are trying to hold on for dear life with their nervous system, with their mouth, getting the food in. They have so much air in their body that they are super tight, just trying to hold on. And based on the way that the mom held them in utero, too. I mean, like, don't come after me, but I think Pilates is the devil for this, right? All these moms want to have this like super nice body, and they think like this is really going to help my pelvic floor, this and that, but their bellies are so small with such little space in there, and Pilates in particular knits the ribs together. That's the goal of Pilates, knit your ribs together, that the babies can't sprawl, right? So they come out.
Great postpartum, but like during the pregnancy, like let the baby sprawl out.
Yeah, like your diaphragm needs to move. I can't tell you how many women I treat post who are still peeing in their pants because their diaphragm does not move. Your diaphragm should come all the way down when you inhale and stretch and relax all the way up here when you exhale. And these diaphragms are stuck like this on their ribs. Of course, you're going to pee your pants if your diaphragm can't move and your pelvic floor is a diaphragm and they have to move in tandem. Of course, right? Um, anyway, so I digress.
That'll be another podcast. I can't wait for that one. I mean,
So,
I really do want to get into the connection between breathing, restrictions, pelvic floor. So stay tuned and come back for that one later.
so the tight baby I find is like once you work out those tensions, right? With simple stretching, breathing, movement exercises, release work, better feeding skills to calm their nervous system, that super tight baby becomes this, okay, I'm loose now and I don't know what to do with my body, baby. You really like we peel back these layers, and more times than not, this baby's actually way too loose and we're just trying to hold their lives together, just like us.
How often do you find that the really loose babies do have a diagnosis like Marcelo that is like a connective tissue issue?
Their moms aren't crazy like me, so very, very infrequent. However, because I am a crazy person,
Well, it doesn't mean that it's not there if it's not diagnosed. It might also be there.
I do. There's a bunch, at least a handful a year,
Mhm.
um, where I am like this. I'm looking at mom who's sitting in a W sit on my floor, has no idea with her, her hunched shoulders with the same TMJ issues. And I'm like, well, tell me
You're
about
the
you.
floppy mommy.
Yep, you're the floppy mommy, and this is the floppy baby, and we can't expect anything different. And that's not to say that this person isn't functional in life. And that's, I think, the bigger issue hmm, thing that we have to talk about with parents, because everyone gets defensive and sad and takes it personal. And it's really not. It's just that, are you functional in life? Yes. Like you can be a banker making $1 billion a year and
Do you
be
want an
chill.
easier path for your baby? Because yes, you figured it out. We're amazing at compensating and adapting. Could they have an easier path forward?
Exactly. So like, hey, and these are the things that we can do now to facilitate this better outcome. I love my favorite, which I had one in here yesterday, but I have a lot on my caseload, is the special ed teacher. Because the first thing I say to them is, what is the number one diagnosis in your classroom? And do you know what they say? Yes,
No,
you do.
mouth breathing.
No, diagnosis. Like, what do you
Oh,
think?
like ADHD.
Exactly.
Yeah.
Like, they're like ADHD. And I'm like, exactly. So let's peel back what ADHD is.
Right.
Not to say it's not chemical and
Well, there
hereditary.
is some, right? Like there, of course there is, but it's not all. It's like
And how many of those ADHD kids actually don't sleep well? And the one in
that they're
particular,
just
that's what I said. Every single one of my kids with ADHD comes in with bags under their eyes and tells me that they do not sleep well. So everyone, and I'm
one
like,
of one of my favorite things to say is when you check enough boxes, like the responsible thing to do is uncover the root cause. And if the root cause is not poor sleep and poor breathing, fantastic. Celebrate the crap out of that. You've ruled it out. But if it seems like it could be part of the story, address it, identify it, because there are things that can be done that are really non-invasive and easy to start to like get that kiddo back towards comfort.
right. And it's not going to change their diagnosis likely, right?
Correct. If
They
it's true
still, they can still
neurologic
have,
diagnosis, it's not going to go away with correcting their breathing and their sleep.
Their executive dysfunction still needs to be addressed, right? But if they sleep better and they breathe better, are they going to be able to manage these things a lot better?
One less
Yes,
thing, they're not having to fight so many different fires at the same time.
exactly. So, I mean, that's where I start my conversations, right? Oftentimes in these kinds of situations. And going back to that floppy baby of preparing these families for the future, because yes, I'm treating your baby, but usually I love to overwhelm a family by telling them in 5 years, this is what I want to see from your child. And I like to give everybody this is the start, right? Like this
The
is where you
journey.
are.
This is a journey. It's not a magic bullet.
Huh? This is where we are now. This, ideally, if I had a magic ball, like a magic crystal, I would like to see this child every single month until they're 3 or 4 years old, just to stay on top of it. What are they doing now? What are they doing now? How are the reflexes now? How is their nervous system now? How are they breathing? And in that way, you can actually stay completely on top of it. This is not reality, right? Nobody is going to do that. Most nobody, almost and nobody is going to do that. So therefore, just me getting it off my chest, I feel a lot better saying, hey, you know what, at 2 or at 3, based on the tone that your child has, their tongue may not be strong enough to create the shape of the mouth and create the shape of the upper area that we really want, even though you're going to do your absolute very best. And I trust in you as the parent that you are going to do that. And you're going to do your very best, right? Which might not be that person's very best.
Right.
But in the future, if their mouth is not big enough, we also have other interventions, right? We have early orthotropic palate expansion that can help, and we have other, even more easy tools to use as they from the time that they're 6 months plus probably that we can get in their mouth to try and do this mechanically that can still stop you from the future, the 30-year-old with the TMJ issues and pelvic floor issues and jaw issues and
And
sleeping
chronic
issues.
inflammation and poor sleep and anxiety and all the things. But I think about that all the time because I am great at overwhelming people. That's one of my skills. I have it top of my resume, but I just love to give it all right away. But I also recognize that as the parent, I think that this has helped me a lot being the parent and recognizing how hard it is, how hard the journey is to stay on top of it all. And it's reasonable and important to take breaks and recognize that a lot of us made it into adulthood as successful humans with different adaptations. So if you have to put down the journey for a minute and take a break, it's going to be able to be picked back up again. And if that's what's important to your family, you can do that. And I think that that's an important message for anyone on this journey is that you do the best you can and keep coming back to it when you want to. If not, the body's going to compensate and adapt and you're going to survive. But could we keep getting you back on the path that requires effort and work to in actuality have an easier journey?
Exactly. And, as a parent who has gone through it all and down the inflammation pathway, I mean, my kids have diagnosis of PANS due to all the things that I have given them in their lives, right? I use myself as the example all the time. Like, hey, you know, parents will say, they'll come in even with something simple like, oh, my kid has been crab crawling. And I'm like, okay, great. How long has this been happening? They're like 3 months. And I'm like, okay, you could have just told me like the first day, we could have done a quick tweak. But you know what? Alas, here we are because they were done. Like they were toasted, right? From the first 3 months of their failed nursing journey or something to that
That's
effect.
so exhausting. Yeah.
Right? Like, of course, they didn't think about this as maybe a quick fix issue. And I use that example all the time. Like, listen, you know how many times that I have personally taken my kids off all of their natural supplements? Mind you, my in-laws own a health food store. So my kids have been on natural supplements their entire lives, like since the day they were born. We've seen all the weird voodoo doctors that you could ever see. And even me still using Western medicine now, right? Because that's what we need to do. But I take huge breaks. We only have checkups with our PANS doctor once to sometimes twice a year at this point because I cannot do any more than I have already done. When I have my own homeopathy appointments, or I should say for my children, the homeopath is always like, but maybe we should address your nervous system.
And like there's a finite amount of energy. There's a finite amount of resources. There's a finite amount of time. Like you have to pick and choose where you want to put your energy.
Yeah. And they're like, but you are taking all the brunt. So like maybe you should be the one to be treated, not your kids. So that like if we treat you, the
The
nervous
ripple
system.
effect of you might actually be really impactful on them. Yeah.
Like, totally. That's why I go to tell, get you. That's why you are supposed to get treated as the parent, as the body worker, as this, that, and the other thing. You are the one who's supposed to get treated because you are the one driving the boat, right? And
What is it? Put your oxygen mask on first.
1,000%. And I'm the worst at this
We all
situation.
are. We all
The
are.
absolute worst. But it's true. I mean, every time I go to, at this point, I've done every single craniosacral class that you probably could ever take. But like, let's just say you go to one of those and it's a 4-day thing and it's a million people's hands all over you and on top of you. Every single time I go to one of those, the rest of my family falls apart. And it's because when you are treated, it's this ripple effect. They automatically feel it. They're feeling it from your house when you're in some sort of, in a hotel doing at your coursework, right? So that it just shows you how powerful all of these things are and how powerful treatment is for yourself. So, practicing craniosacral therapy, I always have my hands on the mom at the same time. I love working at the breast the most because you automatically have your hands on both people.
Correct.
So even if you don't want to tell the parent or they can't handle the fact that they're being treated, let's just say you're not keeping secrets, but
But you're
you
impacting them.
yes, you are impacting them. And as therapists, we know how they're feeling at that time too. Like just listening to their story, you have to maintain your neutral body and you actually can help change them. So working at the breast is my favorite time because you are automatically impacting both the
Both
mom and
humans.
the baby. Mhm.
And the dyad as a unit, right?
Right.
How do you find like for a lot of our listeners, they're already well versed in all the different therapies out there. There's PT, CST, OT, Chiro. For somebody that's maybe just new to this journey and they're just now starting to dip their toe in, trying to figure out how to be their healthiest, to breathe the best, to function the best. How do you explain the connection between CST and PT? Because those are your two titles. And where would you recommend somebody starting to look for help where they are? That's two
Um,
questions. Let's start with the first one. Start with
it's
the
a
connection.
little bit of a loaded question because they kind of like go together, right? But it really where to find your help is very individual just because it kind of depends on where you
Correct.
are, where
Yeah.
you live, what help.
Do you see patients online or do you do online virtual treatment or not anymore?
So I do consulting,
Hmm.
right? Like
Yep.
no
Yep.
one can treat outside of their state, right? I consult all the time. And through my coursework, right? Like through my platform, you, that gives everyone the general basis. And then from there, we always Zoom, right? Like, all right, Beth, I've been doing your coursework. This is what my baby looks like. Can you give me some tips and tricks for
Yep.
this, right?
So
So,
coaching and consulting, but not healthcare. Yep. Not medical advice. The state line.
it is when you talk about craniosacral therapy in particular, in terms of how that relates to PT and how that relates to this baby, again, there's like 10,000 different ways that you can go. First of all, I would say that craniosacral is the most gentle form of therapy that we can give. And a lot of these people, babies in particular, do need really, really, really gentle treatment. Um, you are addressing the pump system, right? You're addressing the fluid. So your brain, your meninges pump out your cerebrospinal fluid. It goes down your spine, which I think a lot of people understand that concept that there's fluid in your spinal canal, but it also then goes out to your limbs. And the only way to access that is through extremely light touch. The moment you actually lay your full weight of your hand on top of somebody, you're now touching their muscle. You're no longer touching the fluid that's flowing between. But with that super gentle touch, you're now accessing the fluid flow. And from that, that's where you're going to start to feel those fascial restrictions. And those restrictions, that's where they tell the story because your body holds emotions in fascia. So you can be treating a billion different things. You might be treating an actual orthopedic issue, like an orthopedic dysfunction, like a frozen shoulder or something like that, right? Like you're trying to actually get them to move their shoulder more. Or you could also be treating the uh the punch that somebody got to the shoulder from their abusive father when they were 5 that they don't remember. because fascia holds emotions, right? And this is where it gets a little, voodoo-ish, where some people will be like, that's total BS, Beth. Like, I don't believe that at all.
Don't have to believe it for it to be true, though.
Yeah, exactly. The first question I ask when I'm treating someone who is of cognitive status that can answer questions, because babies cannot answer your questions, is, hey, what are you feeling here? Like, what's going on in this area? Oh, I don't know. Nothing. I've had some pain here. And then as you're just working it out, because you're maintaining your neutral, that's when the stories come into their brain of like, oh yeah, you know what? Actually, I've had some skiing accidents. And so those are the ones that become more of the orthopedic, and sometimes just memories will just be triggered, right? And then you're like, you have this whole epiphany of, I guess this is what had happened to me before. It can be as nuanced, completely unrelated of, let's say, a family that I had the other day. I Mom has a very high strung nervous system. We talk about her family a lot. And I was treating her, actually, in particular. The baby was nursing, but I was treating her, on her abdomen. And we were just chatting. Honestly, we were not focused on like, hey, we're going to fix this one problem. I was just like, I feel a lot of restriction within this stomach area, this pelvic diaphragm area. And we chatted through it. Lo and behold, she comes in 2 weeks later, and we were talking about what had happened. And she said, I did prep her with, hey, you might be very emotional. You might be very angry. Who knows? This is your body integrating your treatment session. You might feel absolutely nothing. But if you go home and you're a hot mess for the next few days, this is why. So just an FYI, right?
Okay.
She comes back and she's like, I have been dying to tell you that, like, hey, you know what? When I had my baby in my belly, this is an older child, right? When I had this baby in my belly, I never really like felt them in my belly. I wasn't really, I feel like I missed out on some of these things. I think my brain was in a different place, blah, 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 blah. On my way home from our session, the song came on that I used to listen to the song all the time when I was pregnant with her, and I'd be like, yeah, this is my song. So that song happened to come on the radio, and all of a sudden, my entire stomach felt like I was 9 months pregnant with this child. And I felt every movement that was happening with this child. She's like, I felt like my stomach was so big that it was touching the steering wheel, and I could feel her inside of me. And I had to be like, whoa. She's like, I literally audibly said out loud, whoa, like this is what's happening. So, again, we're talking about things that you don't realize have impacted your life, that
Or impact your structure too.
Mhm. that are that have impacted this child. Right? And so it's not my job to also connect her dots. That is her job and her brain and her nervous system. That is her job to connect her own dots of like, maybe this is affecting my child's nervous system. Maybe my child's nervous system is heightened, and there is a piece here that has to do with the fact that it was brought to my mind that I really didn't feel her, and maybe there was a connection situation that was happening there, and maybe this is why I'm seeing these exact things in real time now, based on that lack of connection there.
That's
Right?
wild.
I mean,
So
it's
with babies, it makes sense like to do a really light touch, like the gentlest treatment out there, the gentlest therapy, craniosacral. They're tiny, they're infants. How does the craniosacral therapy help adults? Obviously, releasing, you know, stored trauma or emotions that we don't know that we have. Is there a physical benefit to it as well, other than just, or is it just truly just helping the fluid keep moving, and then that helps you with a deeper muscle touch?
as those fascial strain patterns unwind, the actual fascia itself, and the fluid releases these really gentle restrictions. So it doesn't matter what was holding it in. Was that an anatomical issue, an orthopedic issue? Was that an emotional issue? Doesn't matter.
Whatever, it's just moving.
In the end, all of those things can unwind. And babies, because they are so sensitive, unwind really quickly, right? Now, you can get a baby that was like this within the end of the session here. However, the big however to this is that if the baby then continue, if this is a structural issue or an orthopedic style issue, and that baby goes back to the breast and goes back to the bottle and then does all of those same patterns that they had already been doing, they're going to come back and end up in the exact same way within X amount of time. For some babies, that's within a few days. For some babies, that's within a few weeks. You have to continue to address the function. And this is where physical therapy, so 20 minutes later, this is where your question is answered. So
I know, I had no doubt we were going to get there.
this is where the physical therapy aspect and the craniosacral therapy aspect have to come together. Like we have to work on function as much as we are working on the integration
Fluid,
of the
yeah.
body. Yeah, all of that movement, whether you're doing myofascial release, craniosacral therapy, whatever. Um, Certainly, craniosacral therapy sticks a lot better for some issues if there's an emotional traumatic component to it, right? Like if you were actually had a frozen shoulder because your whatever your dad punched you and now this comes to fruition, you can release that emotional trauma. You're going to maintain that release now a lot better than is it a tongue tie that's actually causing all this tension, right? So if you have a tongue tie and your tongue is connected to your tongue, neck, diaphragm, hips, pelvic floor, inner thighs, calves, feet, right? Preaching to the choir here. If that is the case, and this child still has a tongue tie, right, and where that fascia is actually restricting, and this is a fascial anomaly, and this is a problem. Even if I can get them out like this, if they go to the breast and they cannot use their tongue in the appropriate manner, they are going to then rebound and rubber band that back at some point, right?
I
And
think
for
it's similar to like I have a patient that told me recently that they have been, very diligent going to Cairo once a week for most of their adult life. And after their release, they feel as though their adjustments last longer. They feel like they can maintain that feeling of walking out of Cairo, whereas before they would feel good for a moment and go right back. And
exactly.
it was like such an aha moment for the patient. It was really cool, but it reminds me a lot of what you're talking about at the infant level too.
Yeah, I mean, I always say it's like cutting the pantyhose at the knot, right? You getting a frenectomy, like you can't if you stretch it, it's going to stretch back, right? But if you cut the knot off, now the whole system can unwind. Those are going to be your long-lasting results. And that's one of my talk points, one of my biggest talk points to all of the families that I have, because I think in the end, a frenectomy in particular is a choice, right? You have
Totally.
to choose whether or not you want to undergo this small procedure for your child or for yourself. And it is a choice, but the rubber band effect is real, it is true, and it is very based on form and function. Like the if the function isn't there, no matter what, you're going to end up back in those same places, even if it's not a true tie, right? Because that's one of our bigger issues, figuring out what is a true tie and what is just tension in utero positioning, maternal stress. Mom had a really difficult pregnancy. Like we have to peel all those layers back first, then find that this is actually still an anatomical issue.
The anatomic
Now,
roots don't go away.
right, it's not going to go away. And it's still going to give you that rubber band effect, right?
Mhm.
And then once that's treated, now you still have to work on the same things. You still have to work on form. You still have to work on function. You still have to work on that
But you're
release.
not
Those
fighting in
things
that
stick.
that
Yeah.
holding back pattern. Yeah.
I always say it's like a CrossFit um, uh, athlete running with the tire on their back. Does the tire make their workout harder? Yes. Is that their goal? Yes. Does the tire make their workout harder? Yes. But can they do it? Also, yes. So your child with a tongue tie is like running with a tire on their back. They're trying to pull their tongue over the gum line, cup it around, and create this little hot dog bun. And every time they come up, it's snapping it back. It's snapping it back. So can they physically be capable of getting the milk out? Often, a lot of times, yes. Sometimes no. A lot of times, yes. But is it making their workout so much harder? Yes.
Yes.
Like you're running with a tire on your back. So
Well,
cutting
and
cutting
thinking about the mom sitting in the W seat in your office who maybe gets defensive that there's a problem with her or has always been a problem. You can do it, but you've just been working so much harder for your entire life. You can do it. Do you have to do it? Right? Like I think that's the biggest thing that people need to understand is this is not a life or death situation. It's can we decrease risk and make paths easier, even at the expense of hard work now? And that's a personal decision. It is a choice. Absolutely.
Yeah, and parents every day, so right, the apple doesn't fall far from the tree. Every day in the hot seat will say, okay, so say I have Beth, I have every single one of these symptoms. What do I do? And I'm like, well, here's the the long and short of it, it's hard. You have to go to ENT, you have to check your airway, you have to check your septum, you have to go to airway dentist, see what your palate looks like. You have to go to the physical therapist and do your postural work. You have to do all of your fascial pre-work. You have to go to myofunctional therapy and make sure that your tongue is actually doing the right thing. You might have been swallowing wrong your entire life, right? So you have to do all of these appointments before, and maybe years worth of therapies before, to then maybe, if you need it, get your tongue tie clipped in the end so the car can fit in the garage, right? Or we can do a couple of sessions here and get that car to fit in the garage literally within weeks, right? Like that, like we have to go to 12 doctors as an adult, but right now, within a few weeks, we can get to be headed toward the right direction, on the right path, as simple as,
100%. And, and that's not to, I don't think that she's trying to deter adults from going down that path and getting the treatment. I think it's more of to make the point that it only gets more complicated, it only gets harder, only becomes more invasive or like less accessible as an adult. It can be just as impactful. It can be really impactful, but it's not easier.
Oh, 1,000%.
And then as far as people finding somebody, right? Like, so the nice thing about the World Wide Web 11 years later from when you started is it's really prominent, and all these people that are listening to us are in all nooks and crannies of the world. It's really hard to find your team. And luckily we have access to courses online for parents and patients. We have access to coaching and consulting online. But to find somebody physically, I think it does come down to getting to know your community and being comfortable interviewing providers in a way. Like, it might take several consultations or it might take several visits to find somebody that not only has the knowledge, understanding, background, and openness, but also really vibes with you and connects with you, because that's a big piece of it too, is you have to have this like comfort and trust. Do you have any suggestions for when you're looking for somebody physically?
I mean, this is the hardest question I really find, the actual hardest.
And that's why I'm asking it, because we get asked it all the time.
Um, Even me in particular, I live in like a nook and cranny of New Jersey, and for sure there are other providers that are more accessible to me. And so I can be not the first choice, right? I am the cleanup crew a lot. Because they have gone to someone who is more local, more accessible, and maybe not seen the results that they thought they were going to see, which is a different thing because maybe they just weren't prepped with the right, you know,
Tools, mindset,
not even tools, but like thought process behind like this is what your
understanding.
baby looks like, understanding that like this your baby has these issues and it's going to take longer for your baby than your best friend's baby who literally got a frenectomy, didn't go to any therapist, any chiro, anyone, and they turned around and became 100% within 48 hours. That happens, and
Yeah.
that's more the unicorn. But if that's your basis, right? So they thought they were doing the right thing by doing the therapy and they didn't get the results they want. Maybe they just weren't adequately prepped with this is what's going on with your child, because not every child is the same. But I'm also often the cleanup crew because I have a lot of experience in all of these other issues. BVD, which we didn't even get to talk about, but binocular visual dysfunction, which I found.
That'll be episode 3. We're going to come back at pelvic floor and then BVD, guys. Stay tuned.
Yeah, I mean, visual, this is like the new, because my brain, of course, as yours, is also ever evolving. I really am trying to bring way more vision into my programming
I can't
than
wait.
before.
Episode 3 with you is going to be with Liz too, because this is one of her favorite topics.
Yeah, bringing vision into everything, like vision enhances reflex. We didn't even talk about reflexes, but we all know about reflexes. Those things. But vision is the actual extra piece in that in particular. So maybe your issue wasn't that you were seeing the wrong not a good provider, but maybe not the provider that just so happens to understand the nuance that your family needs. So I think this is a really loaded question because again, it really can depend on what symptoms that you have or your baby has or your family has, and then finding the providers who actually know how to treat those specific issues. Because if you have a lot of asymmetries, that might be more visual and reflex related than attention problem. And you need to go to a therapist who understands those problems more. Or if you have a heightened nervous system baby who screams bloody murder all the time, you probably do need more of a really gentle touch craniosacral therapist to kind of calm the nervous system down before you work on the function and not most, some, I don't know, I can't generalize. Craniosacral therapists don't also do the functional aspect of it,
Mhm.
right?
I mean,
So
it's such a gift to the world when you can find somebody that has training in multiple modalities.
yeah, and truth be told, a lot of my clientele is also younger. So if they turn 18 months and they're like, well, I'm having, Beth, we're still having a solid feeding issue and this and that and the other thing, I'm not treating that person,
That was
right?
one of my
Like
questions is what is your demographic of patients?
mostly revolves around infants,
Mhm.
right? The younger than walking infant. Uh, and some older than one. I have an eval for a 17-month-old tomorrow, and who knows what I'm going to find. But I always check their mouth too, of course. But that's not to say on that 17-month-old who's not walking, if they also have feeding problems, I'm not going to be doing solid food, feeding skills with them. That is a speech issue. That is a speech therapist, feeding therapist, scope. But am I going to be treating the postural control that is related to those feeding issues? 100%. Am I going to be treating those reflex integration issues that is related to those babies' feeding issues? 100%. So it kind of gets a little spread out once they get older. But my main jam is
Okay.
our infants, like breastfeeding difficulty, uh, dyads. And even that has changed. I was just talking to my husband about this last week because of the increase in education for lactation consultants and the amount of courses that are geared toward them. And it's great. They, craniofacial, like the Gillespie approach, let's just say, is very much doing a lot of programming for lactation. So a lot of those consultants are taking this type of coursework, which is similar to craniosacral. Um, and so I feel like those provide some babies that I would have automatically gotten as referrals from IBCLCs are now being worked on by the IBCLCs. And it is of their discretion of whether or not they think that this baby now needs extra
Extra
help.
help. Yeah.
And whereas we were as the therapist, okay, we see the issues that are going on here. We are treating the diet at the breast. You go and treat the baby for these functional issues. We don't get the same amount of babies because now IBCLCs are educated more and have access to more coursework in which they are taking,
Yeah.
right? So,
And that's hard too, because I mean, I think that I could talk to it from the perspective of like us I always call us the structuralists, right? The airway dentists that are doing the tie releases or doing the expansion or quarterbacking these cases. But I had a conversation with a local feeding therapist. And in an ideal world, and not from an egotistical way, but from an experience way, she's like, I want all the babies. I know that I can treat all the babies the right way, the most comprehensively. And my experience is not, you know, comparable to anyone else in our area. And again, that's just fact. It's true. And because she's one human, she cannot see all the babies that are born. It's just not possible. So then figuring out, okay, who else in our area can take the maybe more straightforward cases to keep space in her schedule to help the really complex ones. And I think that takes a lot of coordination and trust of your interdisciplinary team members and recognizing that there's more than enough babies out there for everybody and figuring out where do you fit into the puzzle? How can you collaborate and work together so that more people can get help? Because if you are, a bottleneck to one person or one group, then all of a sudden there's just not enough help for anybody. And then no one's getting help.
totally. And that goes in both directions
Mhm.
in their in their world, right? Right. So
Recognizing
let's
that
just say
this is
that this
beyond what I can help. Let's get this out of my caseload so I can help more of the easier caseloads and get this into a specialized set of hands, right?
and it takes confidence.
It does take confidence.
It takes guts. It takes
It takes like
humble,
an
a hum
abundance mindset, right? I'm not afraid of
yes,
losing referrals. I'm not afraid of
yes,
losing productivity.
yes. And I think sometimes, especially in this world, in this coast, literally the outside of New York City are the most stressed, hardest hustle type A kind of people that we have here. And I think we probably are the hardest headed where we have to like humble ourselves to say what is within our wheelhouse and what is not, and like when to refer out. All of us.
And you cannot, or you should not have to carry the weight of everything. You don't have to specialize in all of it. Understand it, that's great, but understand it to the point of this is how I bring in more help.
Yeah.
I,
And it should be just that. It should just be collaborative. Like, hey, you're really good at this. I'm going to refer this to you without there being a sense of defeat, a sense of failure that I couldn't treat that person. And I sometimes feel in our area that that is what's happening.
well, and
That
also that creates a lot of stress, right? Because then you're not having a successful case, you're not having a successful outcome, and it's creating angst and anxiety and making your personal life, not only the baby and the patient's life harder, but like your life harder. It doesn't have to be hard. You can just stay in your zone of genius and be happy.
totally. Totally. And specifically our lactation consultants, the ones who work in the hospitals here, more the Jersey side, the New York side still has a lot more bureaucracy, I think, than the New Jersey side. But they actually, I think they have the best balance of all of this because they maybe it's because they're W-2'd, I don't know, but like have they definitely take their wheelhouse of like, hey, we're going to treat this diet and then we're going to refer out to X, Y, and Z for all of these extra things.
You
And they
take
have
away the
these,
stress of having to own your own business and
yep,
thinking you
yep,
don't have to think about everything else that floods in. You can just put your blinders on and be patient centric.
totally. And
I
I
think that's
think that just owning your own business and the stress of owning your own business is sometimes that's the switch. That's the fact. That's the switch where you may be taking in the wrong cases or holding on to them too long or not making as many referrals
I
because
had this
you
conversation
are
recently from a dental point of view of like early on in my restorative dental practice, like just being hungry to bring in enough work to keep the doors open. So I was saying yes to all the procedures that I hated doing, wasn't great at doing, and that adds to my own mental health issues. Whereas if I would have been able to be strong enough mentally to believe that it was going to work out and put down that fear and just kind of believe that it was going to be okay, it would have been a much easier path. But that is scary and that's hard.
yeah, it is. I mean, working for yourself, like I'll take me in particular, right? It's just me. So like whatever 50% of this household is, my husband does work. We are both a working family. Um, I do have to make money to keep our lights on, you know? So of course there is that as a factor, right? And then you have to take a step back and say, I'm confident enough in my skills and the right cases will show up at my door
Right.
versus every case or cases that cause me more anxiety than is warranted, than is needed, because there are clicks and things like that and referral issues and people who like you and people who don't like you. It's a little bit of high school, and I would love to say that that's not the case, but that is very much the case in our entire field, the airway field, right? I
I
mean,
think
for years,
probably in every field. But
yeah,
yes, we can feel it
we
in
were
our
having
field.
the fight, right? Like we were having the fights over who should be doing what should lactation should be doing. Is PT the same as going to a speech therapist, and are PTs and OTs the same? And
Well, we're
who's
having it over here
right,
with dentists and orthodontists and ENTs and like, yeah.
right? So like, you know what? You just have to be confident in your own abilities and know that the right clientele will always find you. And so if you're the parent, you also have to kind of like give yourself a little bit of trust too and go with your gut. And you said this before of like you actually have to jive with the provider too. 1,000% you have to jive with the provider. If this provider that you're going to go to, say it's me, and you're like, oh my God, she does craniosacral therapy, she does physical therapy, she does myofascial release, she's like feeding this and that, and you come here and I'm too intense for you, then you have to be confident in yourself and be like,
Not a good
me,
fit.
yep, not a good fit. My nervous system can't handle Beth, right? So you as the parent have to be confident that that could be, you
That
can
could be
say
okay.
that. Yeah, that
Um,
you can say with that.
yeah, I think that's a really important message. And I also think that it helps when making decisions to remember that simple thing of just following your gut, because we're bombarded with conflicting information all the time from providers, from online, from friends, and just kind of like continually going back down to each patient is totally unique. Each patient has a different story. Each patient's going to present differently and respond differently. There is a component that you have to feel confident in, like making the decisions that are right for you or your baby at that time. I can tell you with total confidence that my nervous system loves you. I could be around you all the time. I think that based on how much I love you, and also based on your scope and experience, I would love to have you back to talk about the connection of oral restrictions, fascia, and the pelvic floor and breathing. Like I think that that is an entire episode on its own. And then I would love to talk about reflexes and vision and things like that, because all of these things are connected, and yet we all learn little pieces of the puzzle. But you have to zoom out to see that they all are like interdigitated. They're all part of the same story. So let's do
So
that.
much so. Yeah, let's do that because
Well,
the kid that you treat, right? Oftentimes that mm, orthotropic early expansion kiddo, that is the kiddo that just probably needed more help. And those are the reflex and vision kiddos too. Like the vision, and we can do
start to
it so
draw
much.
a Venn. I just pictured my world in Venn diagrams.
Yeah. And that's the kiddo that I was not like, I would be doing these things with like my kids' age, right? 9 and 11. Of course, I'm going to be doing those. But I started doing blaze pods with a 1.5-year-old the other day, and she got it. And I was like, okay, wait a minute. This 1.5-year-old is
That
doing
one
this
and a half year old is going to have an easier path forward.
and is doing better than her 5-year-old brother
Yeah.
with it, right? Because you are starting and addressing these issues.
And they're both going to be fine. But that one and a half year old will have an easier path in that regard because of earlier intervention.
Yep. That's the goal, right? That's why we're
So
here.
for all of you listening, thank you so much. Come back because we're going to have Beth back on here. Go check her out on Instagram at Little Movers PT. And that's your website as well, correct? LittleMoversPT.com. Anything else you want to say or direct them to?
No, but you know what? Be confident in trust your mom gut. That's all. That's all the answer of everything in life.
Trust your mom gut.
Trust your gut.
Trust your gut. And then, stay tuned for that book that will come out sometime soon.
That's been done for 3 years. Yeah,
Awesome.
You can have it.
Thanks for tuning in to the Untethered Airway podcast.
If today's episode helped you see things differently,
Please share it with someone who would benefit from hearing this. And don't forget to subscribe.
want to learn more about Airway Health or connect with our team?
Please visit our website, untetheredairwayhealthcenter.com, or follow us on Instagram at Untethered Airway.
Until next time, bye.